Hello wonderful students. So if you have thought of the answer for this question as option D, you are absolutely correct. So you need to understand the examiner is mentioning that a child is having chorion and there are new onset vesicular eruption on the fingers. So you need to identify the incorrect statement. So there are two entities here. First one is the chorion, which is the boggy swelling present over the scalp, all of you know. But the next part of the question mentions the new onset vesicular eruption, that is the examiner is giving you a clue that it is a allergic response due to the tinea capitis, the fungal element. So it is called as dermatophytid reaction, which is going to present as the vesicular eruption over the palms. So you need to know the differences between these two. So dermatophytic infection, that is a tinea capitis, which the examiner has mentioned in the question itself. So fungal invasion is going to be there in the scalp. So if you do a KOH, fungus can be demonstrated in the chorion. Whereas the dermatophytid reaction, it is a, remember, it is a hypersensitivity allergic response against the fungal elements. So no fungal elements will be demonstrated in these lesions. So if you take a KOH mod from these lesions, there will not be any fungal element seen. That is the first point which you need to remember. Okay, remember the symptoms are going to be mild itching and tenderness in the infection, and also in the case of the id eruption, the patients are going to have extreme itching and also their lesions can be tender. Coming to the treatment part, so if the patient is given corticosteroids, they are going to reduce the inflammation. So mild improvement may be there due to the reduction of the inflammation, but remember the fungi are going to proliferate, so it is not going to cure the infection. So again, in the allergic response, topical steroids are not going to help in reducing the symptoms. So coming to the antifungal therapy, yes, antifungal therapy is going to give beautiful results both in the case of the infection as well as the allergic response, because the fungi are going to die, there will not be any allergic response. So id eruption is also going to reduce if antifungals are given. So these were all the points which are given in the option. So you can see it is a new vesicular eruption is the dermatophytid eruption. It is a form of allergic response, absolutely correct. Lesions are extremely pruritic and maybe tender, absolutely correct. And dermatophytids, they are not going to be demonstrable from the lesion, absolutely correct, because it is an allergic response. And response well to topical corticosteroids, this is a false statement. In both these conditions, the treatment is going to be with the antifungals, topical as well as the oral. I hope this video is helpful. If so, please do hit that like button. Also do subscribe to this channel, and also you can join my Telegram group and also all the Derma groups. The links are there in the description. Thank you so much. Share this among your friends who might be having a similar query, so that their query will be rectified. We'll meet in the next video. Till then, happy learning. Sarvam Sri Krishna Arpanam Sarve Jana Sukhana Bhavantu. Bye bye.